how important is progesterone for the first 3 months of your pregnancy? Very important. You cannot have a pregnancy that's viable, is going to go to full term for 9 months, right, without progesterone. It's mind-boggling that I posted a video on TikTok about bleeding in the first trimester of pregnancy, and I got a lot of responses to where women actually shared that they have difficulty finding a doctor or having their doctor test their progesterone. You can go online to Rupa Health and buy a progesterone test. You can see any doctor that is willing to test your progesterone. It's impossible not to find a doctor that says, yes, I'll test your progesterone, okay? It's very simple, very easy. If your progesterone is on the lower side of normal, less than 10, and you're bleeding, then there's a higher chance that this is not necessarily a perfect outcome for your pregnancy. Can we forestall that by replacing progesterone? That is the key issue. Ideally, yes. And let's say, God forbid, something bad happens and you do lose the pregnancy and you do know that your progesterone was low. Well, I highly advise you to share that with a doctor that is willing, accepting of testing your progesterone and giving you progesterone as soon as you get pregnant. I wouldn't even bother about testing the progesterone. There is no known side effect of having too much progesterone during your first 3 months of pregnancy, because you cannot have a pregnancy without the adequate amount of progesterone. So what is the adequate amount of progesterone? We don't know. I've seen pregnancies go to term with less than 5 in the first trimester, very few. And I've seen pregnancies that are 10 to 15 and have gone to term with no problems. We want it to be over 15, optimal 20 or more. So if you have bleeding, low progesterone, and a beta HCG quantity, your hormone level for pregnancy, going up slow at a level that's not doubling or at least 60% every 48 hours, then we might have a problem with an abnormal pregnancy. It might even be an ectopic pregnancy if you're bleeding and cramping and having pain. So you do want to have an OBGYN that's familiar with these things, that puts 2 and 2 together quickly and says, okay, bleeding, cramping, low rising HCG, low progesterone, we have a problem here. Either we're losing the pregnancy, we need to give it progesterone, or it's already in the tube and we need to monitor it with ultrasounds. So have a physician who is proactive, who's going to take the time to spend the time with you, understand your problem, your concern, look at the big picture rather than, oh, you're fine, 10 minutes, I'm sorry, I don't think this is a good pregnancy. Let's come back next week and check things again. And if you have a problem,